Let's have this discussion now. As South Africa's COVID-19 vaccination rollout gathers momentum, debate has been raging about whether or not mandatory vaccinations should be the way to go. So there are benefits, of course, to incentivize vaccination, like offering shopping vouchers. But what are some of the ethical issues around some of these practices? Well, distinguished Professor Keymanthri Moodley is the director of the Center for Medical Ethics and Law at Stellenbosch University. The Prof joins us now via our video link for more on how we should look at these issues. Prof, it's great to see you. Thanks very much indeed for making time for us here on 405. So this debate, many might say, is centered around the ancient old tussle between what's in the public interest and perhaps what is more in the interest of personal autonomy. How do you see it?
Good morning, Ayanda, and thank you for having me. Absolutely. The pandemic has made us think more clearly about individual interests and the common good, or what's in the public interest. And your topic for discussion around incentives certainly is important in this respect.
In some instances, some people might believe there's one incentive that is clear to work anywhere in the world, and that's if you were to pay people money for getting COVID-19 vaccines. But immediately, there are obvious ethical considerations that come up in that respect.
That's correct. So I think in the first place, where our health is concerned, we should not need an incentive to improve our health or the health of others. It should be something that we wish to do, without being offered anything in order to do it. Incentives are widely used, however, and they are also referred to as nudges. So some form of reward to encourage people to do the right thing. In the case of COVID vaccines, incentives are being offered across the globe, and they differ from one country to the other. The difficult thing with incentives is that they may not always work, and what will incentivize people in one community may not be the same as in another community. So there is that slight problem in terms of choosing the correct incentive. Many of the retail outlets are starting to offer incentives as well. Now, this will obviously improve cash flow, which is important to boost the economy and alleviate unemployment. But it's also an act of corporate social responsibility to support the vaccine drive and to encourage people to get a vaccine. So there are various aspects linked to incentives, and it all depends on what is at offer. Small offers like coffee or soup at a vaccine site are reasonable, but one needs to be careful in terms of how big the incentives become.
And that immediately raises the question about where we draw the line. Do you get a sense that there's a kind of blueprint that might suggest an answer to that? Because if, for instance, any establishment is considering incentives, among the questions they want to ask themselves is the incentive we're thinking about actually even ethical?
Yeah, correct. So it needs to be reasonable. We need to be sure that we're not setting a precedent and that this will be expected in the future for all kinds of other health behavior. So in terms of what is offered, one needs to be reasonable in considering the offer, the discount, etc. We can draw from usually what is allowed in research, and in the context of research, one may offer incentives for people who participate in clinical trials, but these need to be small, they need to be reasonable, and they need to be approved by a research ethics committee. For widespread vaccine rollout, there are no specific rules, but one needs to consider, what would be sort of an unfair inducement and what would be a reasonable form of encouragement to encourage people to take vaccines.
Let's speak a bit more about research and perhaps what history has taught us so far. We live in a society where incentives are actually more common than we might consciously imagine. For instance, even in shops, people speak about discounts. That's a form of incentives. But in the medical space, though, how much of incentivizing people, especially to their own benefit, actually takes place? The only thing that comes to mind as I ask that question is a doctor giving a young child a lollipop after some kind of injection. But obviously, you don't want to live in a world where we treat adults like kids.
Correct. And as I said right at the beginning, we would expect adults to value their health sufficiently to be able to indulge in behaviors to improve their health without being offered anything. The example of the child and the lollipop is a really good one, and is, historically very common in the world of the doctor-patient relationship. But I think where adults are concerned, we want to encourage people to do things for the right reason and to understand the benefits of vaccines, especially in the context of a public health crisis. People are dying around us. ICUs are full of unvaccinated people. The hospitals are full. The doctors and nurses are working to capacity, and they've never worked like this before in terms of an 18-month period in which they've all been working extremely long hours. So it's almost our sense of responsibility to do the right thing towards the healthcare profession, the healthcare system, to others in society and to ourselves in terms of accepting a vaccine without having to be offered an incentive. If the incentive is in the public interest, then well and good. But most importantly, it's necessary for people to think clearly about the importance of vaccination. The vaccines aren't perfect, but they are the best preventive and measure we have at the moment to reduce serious illness, reduce hospitalization, and most importantly, reduce death.
Yeah, you mentioned how we're expecting adults to behave in certain ways. In fact, there's growing evidence that the vaccines work remarkably well. I wonder at which stage you reckon we might have to swap the carrot for the stick.
Mm-hmm. So I think mandatory vaccination is important simply because the virus is mutating. We are getting more and more vicious variants developing around the world, including in South Africa. And because it's a crisis, we need to act quickly. So incentives might be good, but they might take too long to get a reasonable number of people vaccinated. And we do need to get as many people vaccinated as possible, as quickly as possible. So having vaccine mandates in communal spaces is incredibly important, especially where we know we are risking harming other people. Shopping malls, gyms, restaurants, nightclubs, aeroplanes, any environment where there are many people present. That's important to implement a vaccine mandate. Likewise, in hospitals, all healthcare workers should be, required to take a vaccine because they have a duty to protect their patients, their colleagues, their families, and other people in society as well. So there are certain high-risk environments where vaccines ought to be mandated, and there are other communal environments where a vaccine mandate is also really important.
Keymanthri Moodley, thanks very much indeed for your time. Really appreciate your insights here on the AM Report. Keymanthri is a distinguished professor at the Center for Medical Ethics and Law at Stellenbosch University. Once again, thanks very much indeed. We'll keep watching that story for you, get your sense of how it continues to develop.